Congressman Burgess again, and I'm here this morning with Secretary Mike Leavitt, who was the Secretary of Health and Human Services in the Bush administration, one of the top cabinet officials that I had an opportunity to work with, not only for Medicare Part D, but also when we went through the very trying times in our area after Hurricane Katrina and all of the people that were displaced to our area. But Secretary, this morning, everyone's concerned about what's ahead in healthcare, and I just wondered your perspective. What some of the things that you think we ought to be focusing on as we go through this era of health reform?
Congressman, I think there is a widely held aspiration among the American people to assure that every American has access to health insurance they can afford and that the country can afford. I think it's time we got down to that business. Now, the question really is going to be whether or not it's a government-run program, one that the government owns, or one that the government organizes. And the Democrats have put forward proposals that very clearly begin to move health care toward a government-owned, a government-run system. I'm very hopeful that an alternative can emerge that would in fact accomplish every American insured and not do serious damage to our national economic condition. It surprises me that this conversation is being held almost without any discussion of the economic impact that it could have on our competitiveness. I think you and I would agree there are ways we can accomplish every American being insured. We don't have to strap future generations. We don't have to turn it over to the federal government. We can empower consumers. We can provide them with information that will allow them to have higher quality at lower costs. We just need to have confidence in them and use government as an important tool, but use the government to organize a system, not to own it.
So you're asking the government to have confidence in the American people. What a novel concept. I think we should as well. Thank you, Secretary.
Thank you.